Here we are going to find out some good answer related to food and nutrition for NCLEX board. The first question here, the nurse is teaching a client who has an iron deficiency anemia. So the question related to iron deficiency anemias here about the food she should include in the diet. So if patient have a anemia, what food is good for them? So the nurse determined that the client understand the dietary modification if which item selected for iron deficiency anemia. So for the maturation of red blood cell, the body require iron or body require vitamin B12 or body require the folic acid to synthesize complete mature red blood cell. So increase the intake of iron containing food, vitamin B12 containing food, or folic acid containing food is super important to prevent anemia, particularly iron deficiency anemia. So what are the food list? What contain more iron? This is the question here. This is nut and milk. This is a good source of calcium. Coffee and tea, cooked roll or fish. And last one is the organ or dark green leafy vegetables. So vitamin iron is the source is basically meat or dark green vegetables, whole grains, beans, tofu. They are good source of iron, and iron is need for the prevent iron deficiency anemia. So you choose number 4. So now question come again. What are the nursing products? Vitamin C is very important if your patient have a iron deficiency anemia, because vitamin C increase the absorption of iron. What is their rationale? Dark green leafy vegetables are a good source of iron, and organ are a good source of vitamin C, which increase the iron absorption. All other options are not food source that are high in iron or vitamin C. Let me recap something. So here I wrote the body require vitamin B12, folic acid and iron for maturation of red blood cell. So we have to intake of those food they contained enough iron, vitamin B12 or folic acid for maturation of RBC, and also help to prevent the anemias. Prevent the anemias, we said. So first of all, here I want to tell you what are the food source contained the iron, like meat, dark green vegetables, grains, beans, or tofu. NCLEX sometimes asks a question, which vitamin we need to absorption of iron? Vitamin C. Vitamin C increase the absorption of iron. And here, the source of vitamin B12, meat, eggs, and milks. Folic acid source, green leafy vegetables, fruits, beans, fortified cereal, and chicken liver. So if pregnant mother deficiency of folic acid, they chance to develop neural tube defect. If anybody is deficiency of vitamin B12, patient chance to develop pernicious anemia. If anybody deficiency of iron containing food, they have a chance to develop iron deficiency anemias. The question here, the nurse instruct a client with chronic kidney disease. So the patient you are dealing, he or she is diagnosed the chronic kidney disease, not a acute kidney disease, not a nephrolithiasis, chronic kidney disease, who is received hemodialysis after dietary modification. The nurse determined that the client understand this dietary modification if the client select which item from dietary menus. There are four categories, 1, 2, 3, 4. Which one is best for the patient who diagnosed chronic kidney disease and taking the hemodialysis? The keyword here, one is hemodialysis and chronic kidney problem. And there are four options. What are the good food? So chronic kidney disease patient have to take limited protein intake, limited phosphorus intake, or limited potassium intake, or limited sodium intake. On the other hand, I can explain restricted to phosphorus intake, restricted potassium, restricted sodium intake, and also restricted protein intake. So we have to choose some food from here which is less potassium, less sodium, and less phosphorus. So number 4, they said orange juice, also the pork. Number 2, bacon, cantaloupe, tomato juice. Number 2, banana, orange juice. All of these as a good source of phosphorus, potassium, and sodium. But your patient has a restricted to those kind of food has high phosphorus, high potassium, high sodium. Number 1 is the only one where patient, they said here, blueberries, coffee, or wheat. This actually contain the less protein, less phosphorus, or less potassium and sodium. So number 1 is the best option for your patient. If my patient diagnosed the acute kidney problem, that times we choose different kind of food. If my patient have a kidney stone, my nutritional or dietary modification will be different. Let me explain that one. So let me explain some note here. If patient has a chronic CKD or chronic kidney problem, our patient should limit the protein intake, and it would be 0.8 to 1 gram per kg per day. And tell your patient to limit phosphorus intake, and always we have to tell to limit the dairy product like cheese, or tell them to dark green vegetables, meat, fish, eggs, legumes, chocolate or beer should be limited. And when you tell to limit the potassium intake, tell your patient to limit the banana, potatoes, tomato, orange, cantaloupe, avocado, dark green vegetables. All of these are the good source of potassium, like orange juice, strawberry, or tomato juice, cantaloupe, banana, all are the good source of potassium. In case of CKD, they have to take less amount intake. Also tell your patient to limited sodium intake, because sodium, when limited, to control the hypertension. So if your patient has end stage renal disease, we educate same thing for them. But if the patient has a CKD or end stage renal disease, we should provide a calcium and vitamin D supplement. It is very important. But my friend, another important note, important for the patient, end stage renal disease, some books said, we encouraging high protein intake. Protein intake should increase after the dialysis begin due to protein loss in dialysis. Some books said. If your patient has a acute kidney injuries or nephrotic syndrome, educate your patient, limit the protein intake. Usually some book wrote 0.6 gram per kg for non-dialytic patient and 0.1 to 1.5 gram per kg for dialysis patient. In case of also if acute kidney problem or nephrotic syndrome, restricted fluid intake. So fluid intake to daily urine output plus 500 ml during oligouric phase. Also, it is important to educate my patient about potassium, sodium intake. But sodium and potassium intake depends on what phase of kidney problem. If your patient have a nephrotic syndrome, we educate them sufficient protein intake and also low sodium diet. So it is good to follow the doctor's order as prescription or dietitian water. In case of kidney stone, if anybody stone develop inside the kidney, we call nephrolithiasis. So if patient have this problem, what you educate them? If you ask me what are the risk factor who have under risk to develop kidney stone, the patient or the client who intake excess protein, excess sodium, calcium, and oxalate intake, or inadequate fluid intake, they have a chance to develop the nephrolithiasis. So it is the risk factor. So if my patient have a nephrolithiasis or kidney stone, what are the nutritional recommendation? We encouraging the patient intake fluid, usually 2 liter to 3 liters per day. So excess intake of fluid, if the stone is too small, can expel out through the urine. Also educate patient to decrease intake of animal protein, sodium, alcohol, or caffeine. If the stone made of calcium oxalate, it is good to limit food high in oxalate like strawberry, beet, chocolate, nut, or tea. If we see the stone made of uric acid, tell your patient to limit food in high in purine and pyrimidine, or limited intake of meat, whole grains, or legumes. It is important for our NCLEX board exam. The question here, the nurse is conducting a dietary assessment on a client who is on a vegan diet. So the person who take only vegetables, no animal product at all, no meat, no dairy product, no eggs, we call vegan. So the nurse providing the dietary teaching and should focus on the food high in which vitamin that may be lacking in a vegetarian diet or vegan diet. The person who take no animal product, no meat, no dietary product, no eggs, they have a chance to develop vitamin A. They have a chance to develop deficiency of vitamin B12, vitamin C, or vitamin E. Vitamin A, vitamin C, and vitamin E is a good source of the vegetables. Only vitamin B12 is an animal source. So definitely vitamin D, B12 deficiency will be most common, right? So some patient have lacto-vegetarians, means they do not eat animal product, but they like to take dairy product. We call lacto-vegetarian. Some people have lacto-ovo-vegetarian, means the dairy product and eggs they intake, but who is absolutely vegetarian, no meat, no dairy product, no egg, they have a chance to develop vitamin B12 deficiency. The vegetarian do not consume any animal product, or vitamin B12 is found in only animal product, therefore would most likely be lacking in vegetarian diet. Vitamin A, vitamin C, and vitamin E are found in fruits or vegetables which are consumed in a vegetarian food. So make sure every individual following the vegetarian diet has a get the enough vitamin D, vitamin B12, and omega-3 fatty acid. Let me recap it. So when we deal with the patient who are vegetarian, it is important to educate them. But before to go for the education to them, we have to know the vegetarian diet are three categories. Some of the vegetarian is absolutely vegetarian, right? Or we call vegan. So usually vegan do not intake any or no animal product, no meat, no dairy product, no eggs at all. Second category, lacto-vegetarian. They do not take any animal product, but they intake dairy product. Dairy product is okay. And third category, lacto-ovo-vegetarian. They do not take any animal meat. But they intake dairy product and egg only. Okay. And make the person who is vegan or absolutely vegetarian, we make sure individual following a vegan, they get enough vitamin D, vitamin B12, and omega-3 fatty acid. Because deficiency of vitamin D, patient develop osteoporosis or bone demineralization is occurred. And also the person who deficiency of vitamin B12, they have a chance to develop the pernicious anemia, and also the omega-3 fatty acid is important to absorption of other macro and micronutrients. The question here, a client with hypertension has been told to maintain a diet low in sodium. The nurse who is teaching the client about the food that are allowed should include which food. So there are four options. Which food contain low sodium? This is the answer, right? So first one, tomato soup. So an instant oatmeal. This too is high sodium. And also the seafood also contain high sodium, like this boiled shellfish or shark, high food. But sodium containing food like salt or processed food, canned food is always high content of sodium. If your patient have hypertension like this, it is good to avoid. Because high sodium or hypernatremia can develop hypervolemia or can develop hypertension. So tell your patient not to take salt containing food, not to take canned food, preserved food, right? Because this is not good for your health. It is not good for the heart. They can cause some kind of hypertension or heart disease. So out of all, in the summer squash is a less or good for the hypertensive patient, and their rationale: food that are lower in sodium intake or fruits and vegetables like summer squash, they are friendly or low sodium content food if my patient are hypertensive. So we educate our patient who diagnose hypertension, tell them intake low sodium, high potassium, and high calcium. I want to recap some note from here regarding nutrition for NCLEX board exam. If my patient have a hypertension, so hypertensive patient, we could educate them for low sodium but high potassium and high calcium food containing food. So educate them to limit sodium intake and limit sodium to 1,500 milligram, and educate them to avoid food high in sodium like canned food, smoked meat, or processed food. Also educate them increase intake of low fat dairy product, fruits, and vegetables. Also whole grain. The person who diagnosed hypertension, it is important to limit the alcohol consumption. Very important for hypertensive person. If your patient have a heart failure or congestive heart failure, what we educate them? We educate them limited sodium intake, not more than 2,000 milligram per day. Restricted fluid intake, 2 liters per day. Educate them, increase the protein intake, or encouraging them eat small and frequent meal. If your patient is diagnosed myocardial infarction or MI, educate them to avoid caffeine or encouraging to eat small or frequent meal, and also follow the heart healthy diet. If our patient have heart disease, how we could maintain it? We could educate them consumption of low fat, low carbohydrate diet. So how much low? Less than 200 milligram of cholesterol. Avoid the saturated fat and trans fat in food. Tell them use liquid well and avoid spicy food. Increase the fiber intake and decrease the red meat. And also increase the omega-3 fatty acid. So how you get omega-3 fatty acid? Like fish, nut, seed, or plants well. You also educate your patient lower homocysteine level. It can help to prevent the heart disease. All of this information is important for our NCLEX board exam.